Hi everyone, I'm Mathis Mont, and I'll tell you today about my work entitled Whole Brain Radiomics for Clustered Federated Personalization in Brain Tumor Segmentation. So federated learning emerged recently as a decentralized, privacy-preserving model training paradigm. It enables multiple health institutions to train collaboratively a neural network on their task without ever sharing raw data. However, in practical applications of federated learning, these institutions do not necessarily own the same amount of data, the same data quality, the same scanners, they do not necessarily use the same labelization process, etc. And so this is what we call statistical heterogeneity, and it hurts federated learning performance compared to centralized training. A large amount of methods have been proposed to tackle this problem. Among them are personalization methods, so optimizing one model per institution, and clustered methods optimizing a set of models such that each model is optimized for a set of institutions. All of these methods have been proposed at an institution level, and so they basically assume a form of local dataset homogeneity inside institution, which might be too simplistic. We focus in our work on this federated tumor segmentation dataset of 2022, based on 4 modalities of brain MRIs. We aim at automatically segment the different subregions of the tumor present in them, so the enhancing tumor, the tumor core, and the whole tumor. And we also have access to the original partitioning institution-wise, meaning that we can perform realistic simulations of federated learning on this task. If we dig a little bit in this dataset, in particular for institution 4, for example, we were able to distinguish 2 different types of image quality inside this local dataset. You have 2 samples of each group on left and right. So basically, there is a feature shift in this dataset between institutions. Obviously, they use different scanners, but even inside the data of one institution. And so this nullifies the hypothesis of local dataset homogeneity, and this is what we try to include in a novel federated learning framework. We define the sample level clustered federated optimization objective. Basically, we want to optimize C different models in a federated fashion such that each model is specialized for a set of decentralized samples which have been clustered together because they are close in some form. In our case, because they have similar appearance. To capture this information, we chose the radiomic paradigm, and so to avoid communicating raw data, obviously, each institution extracts 93 radiomic features, so basically first order intensity, statistics, and texture features from each individual volumes and communicate them to the server, which will then perform standard clustering analysis, so normalization of each feature, principal component analysis, and Gaussian mixture model, enabling to obtain C different clusters of decentralized samples. Once we have that, we propose to first optimize a global model with standard federated averaging as an initialization, and then to fine-tune this model on the C different decentralized clusters using C Fed average in parallel. In terms of performance, this matches other personalization methods, even if we focus only on the feature shift based on dice course and 95% of those distances. In terms of clustering quality, we showed actually that, well, for institution 4 specifically, where it's really exacerbated, the 2 different types of image appearance are really clustered together and separated they are apart. So basically, this means that these 93 radiomic features are enough to discriminate the image quality and texture, but also that samples with similar appearance are actually close in this feature space, which justifies using clustering methods in that. Moreover, we try to show that we isolate really the textual information in these very small endings to limit also privacy risks by showing that, well, the label distribution between clusters are actually quite homogeneous. So there is not enough information in the endings to perform clustering based on labels, based on tumor shapes, for example. And finally, as a basic privacy validation, since we are communicating information at the sample level, we also try to show that a neural network trained to reconstruct a downsample volume based only on radiomic features is just quickly overfitting, and even like tumorous parts are completely withdrawn from the reconstructions, justifying even more to use this kind of very small endings with targeted information to limit privacy risk. So thank you, and if you want more information, you can look at our paper.